Howdy guys, this is Dr. Jen, your friendly OBGYN. Our topic for this video is Vulvovaginal Candidiasis or yeast infection. Common itong infection na to sa mga kababaihan. Madalas namin nakikita ito sa mga pasyente namin na pumupunta sa klinik. Ano ang madalas nilang complain? Ang madalas kong naririnig ay, Doktora, Makati po ang aking puwerta. Or may nakikita akong discharge na kulay puti na parang milky or curd-like. Yan po ang madalas na complaint ng mga patients na mayroong fungal infection na tinatawag natin candidiasis. And this is caused by Candida albicans in 70 to 90% of cases. Ito po ay commonly meron sa mga vagina ng small amount. Pag nag-overgrow o sumobra ang dami nila, ayan, mararamdaman nyo na ang sinasabing mayroong itchy or makate doon sa ating private part. At maliban dyan, meron din may mga nakaka-experience na namumula, nagkakaroon ng mga gasgas or may masakit doon sa mga singit or sa taas ng puwerta nila or doon sa loob, sa mga sides. Ay madalas yan ang complaint ng mga pasyenteng nagsasuffer sa vulvovaginal candidiasis. May mga pasyente rin na nagko-complain na masakit pag umihi or pag mayroong contact. Dala kasi ito ng irritation or pamamaga doon sa kanilang puwerta because of this infection. Pag may napansin na kayong mga discharge na parang gatas or condensed milk or parang keso na maputi na nagbubuo-buo, parang gatas, no? Ito naman, yan, parang may nagbubuo-buo. Ayan, madalas namin napapansin ito sa loob ng puwerta ng pasyente pag sinilip namin ng speculum. Or kahit sa labas, pag binuksan lang namin ng konti sa puwerta, may mapapansin na kaming mga ganito. Ayan, alam na namin kung ano ang suspect. Yung ibang mga pasyente, kaya nagkakaroon ng sugat-sugat doon sa kanilang puwerta kasi nakakamot nila. Siyempre makate, kinakamot. Lalong lumalala, nagiging mahapde. Kaya ayan, pag hindi na matiis, pupunta na sa clinic, magpapacheck. Anong mga risk factors kung bakit may mga ganitong problema ang ibang kababaihan? Ang mga common na nakikita namin ay sa mga diabetics. Yung hindi nakokontrol ang sugar level. Kakaroon sila ng pangangati sa puwerta. Pag chinek namin ang kanilang sugar by random blood sugar testing or fasting blood sugar testing, makikita naming mataas ang level kasi nga hindi controlled ang sugar, which predisposes them to develop this yeast infection. Kaya importante pong hindi tayo magkaroon ng diabetes or mataas na sugar level para hindi tayo mag-suffer sa fungal infection. Madalas din namin ito nakikita sa mga buntis. Kasi nga, ang buntis ay prone din po na mag-develop ng fungal infection or yeast infection. Prone din po na magkaroon ng fungal infection ang mga gumagamit ng pills or oral contraception because of the hormonal changes. Pati din po ang premenstrual period ng ating menstrual cycle. Nagkakaroon din po tayo ng incidence ng fungal infection. Paggamit din po ng antibiotic ay nagiging isang rason para magkaroon ng yeast infection. Kaya po, huwag kayong basta gumagamit o umiinom ng antibiotic without seeing your doctors. Kasi minsan, lalo natin nasisira ang ating immune system at nagiging prone tayong mag-develop ng yeast infection. Paano nalalaman ng doktor na kayo talaga ay mayroong yeast infection? Number 1, we use wet preparation by using saline 10% with potassium hydroxide. Second, we use gram stain. Kumukuha kami ng sample nitong mga discharge, tapos ilalagay sa slide at iga-gram stain. Tapos makikita doon yeast hyphae and pseudo hyphae. Number 3 is culture. We use Nickerson's medium to demonstrate this yeast species. We have this uncomplicated vulvovaginal infection. Ano ito? This is sporadic or infrequent vulvovaginal infection with mild to moderate symptoms. Causative organism is usually the Candida albicans. This happens to non-immunocompromised women. The other classification is the complicated vulvovaginal candidiasis. Ito yung merong yeast infection na paulit-ulit. Also have severe vulvovaginal symptoms. Mas malala ang na-experience nilang mga simptomas. Severe itchiness, merong soreness, may mga dysuria and dyspareunia, yung masakit sa pag-ihi, masakit sa pag-contact, maga na ang puwerta dahil halos kumalat na doon sa buong area ng kanilang vulvovaginal region, yung infection. Usually, this happens to women with uncontrolled diabetes or who are immunocompromised. Ang yeast infection ay hindi STD. Hindi siya sexually transmitted infection, but it is possible to pass the yeast infection to your partner. Pwede mo siyang mahawaan. And around 15% of men can experience itchiness after contact pag mayroong vulvovaginal infection ang babae. What food you should avoid to prevent vulvovaginal candidiasis? Number 1 is junk food and desserts. Matatamis na pagkain. Second is starchy vegetables such as potato, sweet potato, and corn. High sugar fruits such as mango and banana. Next is processed meat are rich in gluten such as flour. You should also avoid dairy products with high in lactose content such as milk and processed cheese. Ulitin ko po, what are the risk factors that can lead to yeast infection or vulvovaginal candidiasis? Okay, number 1 is uncontrolled diabetes. Number 2 is pregnancy. Number 3 is use of antibiotics. Number 4 are use of hormones or oral contraceptive pills. Number 5 is weakened immune system. So, dapat po tayo ay laging malakas ang immune system. Uminom tayo ng vitamins, uminom tayo ng mga probiotics, at kumain tayo ng healthy foods, vegetables, and if possible, avoid stress. Treatment, can use creams to apply over affected areas. You can use the cream 3 times a day for 7 days. There are creams that you use 3 times a day for 3 days. Also use suppositories. You insert intravaginally daily for 7 days. Meron din daily for 3 days. Meron din single dose. If you're not comfortable with vaginal suppository, you can have oral tablets. You can take fluconazole 150 mg single dose. Yan, isang inuman lang po yan if you have uncomplicated vulvovaginal candidiasis. Single dose lang po. Minsan naman, pag medyo severe ang inyong pangangate, you can have additional cream applied over the affected area. So, pwede kang uminom ng oral, pwede ka rin magpahid kung saan yung may makate. For severe vulvovaginal candidiasis, you can have the following medication. You can have topical azoles or creams. You apply that for 7 to 14 days. Also, you can take the fluconazole 150 mg 2 times, like you take it tonight after dinner, and then after 3 days you take another dose. You can also add cream to apply over the area where you feel the itchiness or soreness. If you have recurrent vulvovaginal infection, that is, it happens more than 3 times in 1 year, you can have the following treatment. One is fluconazole 150 mg. You take that 3 doses 3 days apart. You can also have intravaginal suppository for 10 to 14 days. You insert that at bedtime. If the organism is resistant to the azoles, you can use boric acid 600 milligram capsule per vagina for 14 days. And for the recurrent vulvovaginal infection, you are given fluconazole 150 milligram weekly for 6 months. You can also use clotrimazole 200 milligram cream 2 times a week for 6 months, or the 500 milligram cream once a week for 6 months. You can also use itraconazole 400 milligram monthly for 6 months, or 100 milligram weekly for 6 months. How to avoid or prevent this type of infection? Paano natin maiiwasan? Here are some self-care tips. Number 1, practice good hygiene. You wash your genital area with feminine wash at a pH of 3.5 to 4.5 like this. You use this 2 times a day, in the morning and in the evening. Paggising sa umaga or pagligo sa umaga, and before matulog sa gabi. Use cotton panties and avoid tight-fitting garments or pants. Third is avoid using scented products like pads. Number 4 is avoid douching because it disrupts the natural balance of bacteria in the genital area. Because by douching, you also disrupt the amount of the good bacteria. Number 5 is eat healthy diet rich in probiotics such as yogurt. Thank you for watching this video. I hope may natutuhan kayo on how to prevent this yeast infection at para hindi kayo mamroblema kung bakit merong mga makati or mahapdi sa inyong puwerta.